And AT, I'll let you go ahead and take it away.
Great. Well, thanks. Hopefully everybody enjoyed the networking, and we'll jump right in here quickly. So reminder, we've got 4 founders. They'll go for 5 minutes, and then we'll sort of call time. Any questions you have, please put them in the chat, and we'll either ask one of those live or they'll be able to answer those questions in the chat after they're done presenting. So first one up, Ali from Lialta Health. Ali, I'll turn it over to you for 5 minutes.
Thank you, AT. Good morning, everyone. It's a pleasure to be here today. I'm Ali Rahimi, a heart doctor, a public health advocate, and founder of Lialta Health, a digital health company made up of truly a phenomenal team of leaders in healthcare, engineering, and business who've come together for truly a singular mission to improve the lives of individuals and their families. In medicine, we're taught the diagnosis is found by listening to our patients. So in my brief time, if I can, I'll share a brief story that illustrates our why. So imagine yourself, you're in clinic, you see a middle-aged man who's a husband, a father, and a physician. He does his best to keep up with life and work. He has a history of high cholesterol, working long hours, lots of stress, poor sleep, and of course, lack of regular exercise. He suffered a heart attack 10 years ago and received a stent. He was a regular patient, kept up with his appointments, but then lost the follow-up after a couple of years. Has not seen his regular heart doctor in 5 years. So today, he comes in, you knock on the door, you ask how you can help him. He says he's got severe chest pain. It occurs at rest and is even worse with minimal exertion. You ask about his meds, and he regretfully admits to not taking his cholesterol medication or even his daily aspirin. No labs or regular doctor visits in the interim. You look through his electronic chart to see his last heart cath images or findings, what his last ejection fraction is, the pumping function of his heart, what vessel received the coronary stent. And he rummages through his wallet, pulls out his stent card from 10 years ago, and you see the faded letters, a red arrow pointing to his widowmaker left coronary artery. After you review his EKG vitals and exam, you send him to the hospital for an urgent heart cath. The study reveals severe multi-vessel heart disease. He finds out, he's tearful, he's filled with regret and wish that this would not have happened. What if he had an application that would help anticipate his care needs, that would check in on him while his doctor, the system is overburdened and overrun with so many different responsibilities. So what if there was an application that could help him close the critical gaps in his care? So it's countless stories like this patient that led us to create Lialta Health. It's a personalized digital health assistant. Lialta places the opportunity for better health in your hands. It begins with an assessment of the individual's baseline health resilience. What we mean by health resilience is we measure your health knowledge. How knowledgeable are you about your current conditions and your risks? How confident are you in taking care of your health? We then review their major risk factors for possible heart disease. We understand their heart risk calculator, and we try to ascertain really an opportunity even to integrate with their EHR, their electronic health record, and pull those essential curated health data that we believe are actionable. With that, we then create a personal health journey filled with goals, insights, lots of encouragement, chances to even earn Ali coins, and towards improving their heart health and general wellness. So Lialta Health is a solution that we have designed for individuals and families. It is not an enterprise solution developed for health systems or insurance companies. And we have done this to truly help identify the care needs and close those critical care gaps. So I've got a brief video that I'll close my brief 5 minutes on, and I'll share that with you if I may. It's not allowing me to share, it looks like. My apologies. It's not allowing me to
That's
share.
okay. Don't worry about that, Ali. Maybe if you can send a link to it or something, we can put it in the chat and people
Yeah,
can
I'll do just that.
listen to it that way.
Okay. But I appreciate the opportunity. I'll put it in the link. We're looking forward to bringing personalized healthcare and to individuals and truly making a difference in their lives. I appreciate the chance, AT.
Ali, thanks for starting this. One question here, and then I'm sure there'll be some others in the chat. You mentioned sort of focus on individuals and families to start. How do people get connected to this, or are there certain folks that are the best ideal customers for what you're trying to do? Yeah,
it's a great question, AT. I mean, first off, we're looking to create a solution for individuals. So we have a direct-to-consumer product that allows individuals to download the application. They go through a free 7-day trial. And then in the interim, we ascertain if they're eligible for connection to their EHR. And with that, we can then help pull in some of their health data. We also have a product that we can sell to companies that want to create a wellness program for their workforce. So we've got these two products. Our big lean is the direct-to-consumer route, but it's an application that's readily available in the App Store and Google Play. Great. Well, thanks so much, Ali. I know there's some questions in the chat if you want to follow up on any of those, but appreciate you sharing what you're working on here. And then we'll move on to Jennifer from VacMobile.
Good morning, and thank you, AT, for inviting me to be here today. As Ali had some difficulty with the video, I may or may not show the video demo, but I am going to go ahead and share my screen right now and run through a few slides to give everybody some context for what we're working on here at VacMobile. So just give me a minute here. So at VacMobile, we are focused on bringing vaccination records into the 21st century. Simply put, most vaccination records are still accessed predominantly on paper and in person. While there are portals out there, a lot of folks still have to go and get that paper record initially and then create some kind of a PDF where they upload it through a portal, but then on the other end, it's still being printed out and manually reviewed by somebody. And we've basically identified many different verticals here in the United States. You have over 100 million people annually that are required to show some sort of proof of vaccination for their work or their education. And I've listed them here. And you can see, obviously, you have approximately 17 million in healthcare, another 50 million K through 12, about 19 million higher ed, a little over 2 million for the armed forces. And then, of course, our first responders, you have 25 million first responders in this country that have some vaccination requirements. On January 14th, 2022 of this year, the Supreme Court upheld the most recent staff vaccination requirements that CMS, this rule was put out by CMS. And that's kind of where VacMobile is currently really focused. And the latest release, VacMobile 2.0, is geared towards helping those 17 million healthcare providers that have to have their staff fully vaccinated or have to have a mechanism for tracking religious or medical exemptions. And so I just wanted to point out that when we talk about healthcare providers, a lot of folks are listed here in this infographic that was produced by CMS. This is on the CMS website, that are organizations that may not have had historically the practice of keeping track of the personal health information, the PHI of their employees, folks like home infusion therapy suppliers, for example. So we've worked hard to hard bake right into the app some features that really make this a streamlined way to access that data and to manage that data and to be able to produce the comprehensive reporting that might be needed on a moment's notice, because those government inspectors, those CMS inspectors are showing up sight unseen. There was a big article in Becker's Healthcare Review recently. In the first 30 days, they cited 69 hospitals, large healthcare hospital systems. So I joke a lot that we can put a man on the moon, but but we still don't have a globally scalable solution for authenticating and managing vaccination records. But it is actually really true. We really do not have a globally scalable solution at this point in time. And that's what VacMobile has taken on. And that's what we have worked on. And the reason why this is so challenging is because there's no central repository either in the United States or globally for vaccination records. So there's no way to have an API into every known vaccination repository. So what do you do? And so what we did is we have come up with a way that individuals can both utilize the ability to have an API and have information third-party verified where that's possible, and in instances where it isn't possible, to be able to self-report. And that's the piece that is just so critical right now. You have to be able to self-report, and for an enterprise to have a mechanism for understanding whether or not to trust that self-reported paper record. Because again, as I said at the beginning of this presentation, the vast majority of vaccination records on the globe are still paper documents. So what VacMobile does is it gives that enterprise a way. We have an algorithm that scores that paper record looking for evidence of fraud. So it's a proprietary fraud detection algorithm that we've created, and we've actually trademarked the name of it. It's VASAR, and that stands for Vaccination Authenticated Self-Reporting. And then, as I mentioned before, the app can also track religious and medical exemptions, which is really helpful for those facilities that have to be in compliance. We integrate with the smart health card system. So this map just shows you all of the places all across the United States and around the world where VacMobile can have a validated third-party verified record. And what I'm really excited about is all of these pharmacies that VacMobile is integrated in with, so that in the instance where somebody wants a third-party validated test result, because we also track COVID test results, and in addition to the vaccinations, we can do that through any of these pharmacies. This is our team. We've worked really hard to curate the very, very finest representatives from industry, government, and technology. And we also have many, many, many advisors that are not listed on this slide. But this just gives you a glimpse of some of our team members. I'm super proud that we have the immediate past president of Emory University, Dr. Claire Stirk, as well as Bernice Dixon serving on our board. And then in our leadership team, our day-to-day, our chief product officer, we have Steve Bachman, who's a Techstars mentor. Stephen Goddard is our chief solutions architect, who comes to us from Turner Broadcasting and CTech, and our government master distributor, because VacMobile is selling to the government as well as commercially. We have Colonel Cantwell, and Colin Chung is our chief information security officer. And Colin, of course, wrote the cybersecurity boot camp curriculum for Georgia Tech and taught it before he founded his own company. So that just gives you kind of a quick overview of what we're working on at VacMobile. And
thank you, Jennifer.
Yeah.
Really appreciate that. One question for you, and then I'm sure there'll be some more that'll come in the chat. You know, as you see, like I can imagine lots of different use cases here, right? Whether it's me as a parent wanting to have all my kids' records aligned, or whether it's an employer or a specific pandemic like COVID or the government, who do you see as your ideal customer that would help facilitate using this?
Yeah, so this is our go-to-market strategy is a B2B. It's a B2B SaaS licensing model. So we are focused very much right now on those healthcare entities that have to adhere to the CMS rule. That is where we're kind of laser focused in 2022. But obviously, we have on our product roadmap integrating many other verticals as we move forward. And so you saw in my first slide, there are lots of use cases for proof of vaccination, but where we're focused very much right now is on those entities that must adhere, the 17 million employees of healthcare organizations that must have their proof of vaccination, and or those organizations must have a way to track if there's going to be religious or medical exemptions taken. And so that's what we've done. The app is a free download through a Google Play or the App Store so basically if an organization decides they want to use VacMobile, they would simply inform their employees that they can go out and download the app, create their profiles, and then that organization would have a choice of whether they want to use our off-the-shelf solution where we have a scanner app that can be deployed either mounted outside a facility or sitting near a security entrance, and or we have APIs, extensible APIs that can just integrate right into a physical security software system or an HR software. So we're designed to integrate into other platforms, as well as obviously having our own off-the-shelf solution. So that's how we
Great.
work.
Well, Jennifer, thanks so much for sharing more about VacMobile, and audience, feel free to put more questions in the chat and Jennifer can answer them there. Well, great. Well, next, I think we've got Stephen from Lialta. Stephen, you want to pop on and tell us what you're working on?
HealthIT. Can everyone hear me?
We're good. Yes.
Perfect. I'm Dr. Stephen Thomas. I'm the founder and CEO of Lialta. I'm going to share my screen real quick. All right. Everyone got the screen here? So at Lialta, we are focused on patient loyalty for hospital systems. And the reason being is that, patients are just not loyal today. So, my role, I was a senior vice president of in a healthcare system with responsibilities for the physician enterprise. And one of the, key terms was what we call leakage rate. This is sort of the opposite of loyalty. So this meant that any patient that was assigned or of a employed physician that went outside the system, that percentage is known as the leakage rate, right? And so in my experience, and according to Becker's and others, that sits at somewhere between 40 and 60% of the time patients of a hospital system are getting care outside of that system. And this has massive financial consequences to the hospital system. Somewhere between 10 and 20% of the hospital's annual revenue is lost in the form of leakage. But more importantly, it also has massive quality consequences as patients get fragmented and uncoordinated care. This is costing the U.S. healthcare system tens of billions of dollars. And so our solution to this problem is in our form of our connected membership platform. So we're a B2B SaaS company that contracts with hospital systems and provides a turnkey membership program. So our platform signs up and does the collection of membership fees. We use direct secure messaging to connect members to all the ambulatory front doors of a hospital system. Our platform also facilitates the membership services of personalized care reminders and health navigation. And then it provides feedback about the members and the performance of the membership. And the platform is really, this idea of a connected membership is really rooted in this neurobehavioral framework by a professor at Stanford named BJ Fogg. And he's a behavioral scientist who said, look, if you want a behavior to change, three things have to happen simultaneously. You have to have motivation, you have to have the ability, meaning easy to do, and you have to have a prompt. And so what we've done is we've taken that, in this case, the behavior that we want to change is patient loyalty, and we want patients to make healthier choices for better outcomes, right? The motivation in this case is the connected membership. Members are making an investment in their own personal health by joining the healthcare system. There is a small fee involved in this, and they're declaring themselves motivated through that, through having some skin in the game. the ability is that we've taken the two biggest pain points that patients have within healthcare, that being access and wait times. And we've solved that problem through our member-centric preferred scheduling and fast pass to care. So we've made the ability to access care incredibly easy for members. And then on the prompt side, the third element, those are those personal care reminders. So we remind people of the care they need. We make it easy for them to schedule on their terms and get in and get out. And therefore, we will see loyalty. We've seen loyalty significantly increase at the healthcare system, but also patients, members rather, have better clinical outcomes. And so then the who, this is not a new patient acquisition strategy, in relationship to our healthcare system partners. This is how do you get more out of your existing patients? And so the target with our healthcare system is for those existing patients of the primary care practices with a significant burden of disease. So these are folks with significant chronic diseases. These are your most valuable folks. These folks are consuming 85% of the healthcare resources today. And so I'll leave it at that with, hey, at Lialta, we're focused on patient loyalty for hospital systems by delivering a connected membership program. And that's it.
Awesome. Thank you, Stephen. One question for you here, and then again, others feel free to put questions in the chat. As you mentioned, looked like focusing on the hospital systems to help with some of the leakage, and then similar to what we've asked the others with, there's an angle through the consumer first or an angle through the B2B or the hospital first. Tell us about what you've learned and your decision to start on the hospital side.
Yeah, so certainly, the pain point for the hospitals is the leakage itself, right? I mean, 10 to 20% of the healthcare revenues is lost in the form of leakage. And so, healthcare systems have vertically and horizontally integrated to where they have the full spectrum of care. And so they truly are one of the only entities that can provide full spectrum of care. And so when you look at some of the competitors out there in the marketplace, things like One Medical or things like MDVIP or even the CVSs of the world, they've really gotten to where they're focused on primary care and primary care alone, right? And so, MDVIP is $2,000, upward of $2,000 a year for access to one doctor. One Medical is $200 a year for access just to primary care. And so we want to provide an alternative to healthcare systems in the form of really providing concierge medicine for an entire healthcare system, right? So that's the focus for us, which is the B2B component. Obviously, then in conjunction with the healthcare system, we are then selling the platform. So the members themselves, the recommended price is $200 per member per year for access to that healthcare system, right? So we're a white label. It is the healthcare system's membership program, right? Where we facilitate that and provide the technology for healthcare systems to deliver on that. So that's the focus.
Great. Well, thanks, Stephen. Appreciate you sharing what you're working on. I think there's some other questions coming in the chat as well. Well, great. Danae, hop on and join us here to wrap us up.
All right. Thank you, IT, and thank you, everyone. We're so happy to be here with you today. So I'm going to go ahead and pop my screen. We're starting off with a short teaser. So if the sound doesn't sound, you cannot hear the sound. We're going to put the clip on the screen. So hi, everyone. I'm Danae Moya, co-founder and COO of Dentystem. It's a consumer-centric biotech. So let me play the teaser. So yes, we are a consumer-centric biotech, and basically our goal is to democratize both preventive and personalized healthcare by using stem cells. So what is the problem that we're solving for today? In short, we die from preventable diseases. And what do we mean by that? We've looked at the two most common health-related scenarios that people go through today. On the one hand, we have people who we feel seemingly healthy. And what we tend to do is some sort of proactive annual checkup. But during those checkups, we usually test our vitals, maybe our blood, but we don't really get any early signs of any life-threatening disease that might be developing. We don't do any genetic analysis or RNA testing that might show any possible future health complications. The second scenario that we're all very familiar with, when we're sick, we're not feeling well, we go to the doctor examines us, diagnoses us, and she might prescribe a medication. But in many cases, the medication we might start with might not help our specific condition. So we may need to try more than one until we get to the one that works. But every time we try an additional medication, that increases the toxicity that enters our body and unwanted side effects. And in some cases, it deteriorates our health. And in more serious cases like cancer, it could even lead to death. So the way we want to solve this, we really want to offer people directly the opportunity to store their own stem cells in order to help them make the best informed decisions about their health. Induced pluripotent stem cells, they're also referred to as iPSCs, are cells that have been reprogrammed back into an embryonic-like state where cells can be developed towards any organ of the human body. And there are two big advantages with that. On the one hand, when you go through the process of storing your own stem cells, you can have awareness of any disease predisposition you have, so you can take the appropriate steps to stop it from developing. And we refer to this as preventive. And on the other hand, once you've stored your own stem cells, if you happen to get sick down the line, we can help your doctor make an assessment on which medication might be the most appropriate for you by testing all the different options on your own stem cells in our facility and start with the one that shows to have the highest level of efficacy specifically for you. And we refer to this as personalized. And some statistics, nowadays we live longer than previous generations, but with more sick years. On average, 13 years of our life are expected to be while being sick. And in the United States, 70% of Americans take at least one prescription drug or more. More people actually die from prescription drugs than traffic accidents. And the American Cancer Society estimates within 2022, 2 million new cancer patients to be diagnosed. Within the same year, 600,000 cancer-related deaths. That's 1,600 people per day. So it goes to show that we need to find a different way to approach how we look at our healthcare. So the service that we're going to launch with is quite straightforward. It's direct to consumer, and it's a stem cell storage service. So reprogramming your own cells and storing in our facility. And it's very easy, very consumer friendly. All we need is to receive the sample here in our facility in Atlanta, and then our science team will go through the process of reprogramming your cells into induced pluripotent stem cells. The process takes about 6 to 8 weeks. And from that point, we store them in our facility. Subscription-based model based on a monthly or annual fee, very easy. And the key players in the market don't quite offer what we do. Umbilical cord service, storage companies, and DNA ancestry services don't go through that process, and genomics don't refer to direct-to-consumer services. The market is massive. ARK Invest estimates to be more than 130 billion, with an expected growth of 40% by 2050. My co-founder and CEO, Noel, he's here with us today. He's an experienced stem cell scientist. He's been doing this all his career. I'm an ex-corporate business and marketing strategist, and we have both faced cancer in our direct family members. We're gonna bring on board 2 more scientists at launch. And why are we unique? As I mentioned, we are consumer-centric, people-first company and biotech. Our focus is to start with consumer, and then we will roll out more B2C and B2B services. Our team has expertise in stem cell science, and we're a vertically integrated business model, which means we do everything in-house. That allows us to offer our service at an affordable price point and the highest level of technology. Where we are now, we're about to close our pre-seed round. We already have 5 angels. We're looking to find a couple more to close our pre-seed and get the equipment and sign our facility. And early next year, we will launch our seed round of 2 million that will help us grow and scale much faster. We have a target of 1,500 subscriptions. In the following slide, you can sign as well on our wait list, and we expect break even within 18 months. Thank you, and you can scan the QR code to join our user research and wait list. Thank you.
Awesome. Thank you, Danae. I love the big problem you're solving here. Tell us a little bit more about sort of the science and tech side of how much of the build out is to test, improve versus to pilot and execute, versus sort of to launch? Like, tell us more about where the science is around this at this stage.
Yeah. So a very good question. Thank you, AT. So the protocol, the process of science is open source. This is something that has been happening at a research and academic level for quite a while, actually. And it just has been brought to the public directly. And because of the way the system was, it would take longer to go through the process. But because we're a vertically integrated business model and we do everything in-house, it's something that we can complete within 2 months. And Noel, my co-founder, is here, so he can add if anything needed on the science piece. No? Okay.
Great. And then similar to what we were talking with some of the other founders around the go-to-market strategy, talk to us about your go-to-market strategy of reaching consumers direct individually versus going through any organizations or health systems. Yeah. How are you thinking about that?
A great question as well. So the way we've narrowed down our go-to-market strategy, at least at launch and soft operations, is we have a growing wait list, which you're welcome to join as well. But at the same time, we're working on the side with corporate partnerships. We already have 3 letters of intent from businesses. One wants to absorb the subscription cost on behalf of their employees as an employee benefit. And the other 2 are in the medical field, a medical clinic and a healthcare provider who are interested to kind of show that service for the packages that they offer. And eventually we are in conversations with kind of scaling and going more deeper with the healthcare system. But this is something that we want to take the time to do it right because it's quite complex, as everybody before mentioned.
Got it. And then I see a question coming in the chat here, so I'll ask it here. From your idea, who are the ideal customers or ages when this is most beneficial?
Very, very good question. So our user research has been really interesting in that, in narrowing down based on what was our assumption and what we have discovered today. So unfortunately, we have found most of the people we've talked to that they have had a family member go through a life-threatening disease. So they're very interested to understand how they can prevent it, because in many cases, they find out quite late. So the key is to find early and be able to prevent. So that is a really large group that we're finding to be growing. A second group that is quite interesting is a lot of young parents that might have considered to store the umbilical tissue of their newborns. They're interested to join for themselves and bring their whole family on this. And the third, which is also growing recently, is more the younger health and wellness-minded individuals who really want to take good care of their health, both through their lifestyle and through keeping track of how their body is performing, really.
Mm-hmm. Awesome. Well, great stuff. Let me, we got maybe 10 minutes left here, so let me bring back all 4 of the founders who started here. Thank you so much for taking all the time. I know there were some questions in the chat. But maybe we can do a couple more live for anybody who had questions that didn't get answered. If you want to use raise your hand on the Zoom screen, then maybe JC or I can call on you to ask any questions to the founders. And if not, I've always got some questions ready to follow up.
Maybe why don't you kick it off, AT?
Okay.
And then I'll go back and make sure I can decipher.
Got it. Well, I'll ask one just going around that, as we know, being a founder, there's many ups and downs, and especially healthcare entrepreneurs. What's one thing you've learned in the journey so far that you either felt was tremendously helpful as a lesson learned to where you're going, or was a challenge that, you wish you may have done differently?
I'll answer that. Customer discovery. Don't, learn how to do it. I didn't know what I was doing at first. I thought I was doing it and I wasn't. And then when I learned how to do it, I got better at it, and I did it as much as I possibly could. And I've gained some tremendous insights, and that's been extremely helpful in the overall development of the company.
Awesome. Love that.
Thanks, Forrest. I would say surround yourself with folks who believe in what you're doing and offer you genuine advice. And then build a team smarter than you, diverse, with willing to speak up.
Great. Absolutely. Team, such a critical component. Danae or Jennifer, any lessons learned so far, things you'd share with the audience of things to do or things to watch out for?
Just, I would say that software, developing software is inherently going to take a lot longer and be more expensive than you thought. That's all I will say on that topic. But I will say that don't give up is what I'm trying to say. And we've at this point have $1.7 million that have been invested in VacMobile in the R&D with multiple patents pending. And I mentioned in the chat how when the government came out with paper record as the official record of the COVID vaccination in November of 2020, that completely threw us for a loop. We were not expecting that. And that caused us to have to make some changes in order to feel like we were doing something that was going to be meaningful. So just don't give up. Stay committed to what you need to do. And if in our case, it was digital transformation of vaccination records, and that is a complicated topic. And there's a reason why it hasn't happened yet, because it is hard. It is very hard. But the hard things are the important things. So don't give up.
Love that. We always like to say, the overnight success stories are just 10 years in the making. So it takes a while and you got to fight through a lot like you're doing, Jennifer. So thanks for sharing.
And I would just add, 2 points to build on what Jennifer was saying, that, especially in the health tech and biotech industry, there is a cost that has to happen upfront when you're building a company, which may not be the case for SaaS companies or software-based kind of companies that you can build it on your computer, which is an amazing benefit. So the cost upfront is something that you need to be able to communicate an idea without having equipment. And the second point, which I think is very important for people who are not of scientific background, is to be able to communicate complex terms in a more digestible way to start with, because this was something that we found very interesting in our user research. A lot of people tend to make decisions out of fear or out of, taking a quick action because they've been told to. But it's very important to understand why we take decisions that we take about our health and about, other things, whether it's in our business or in our own well-being. So I think communication is super, super important.
No, very cool. And one other thing I'll add that I think was just fascinating hearing the commonalities across all four of, very different businesses and models. But as we see in healthcare, as Danae pointed out, it's always not as simple as just putting a website and landing page up and click here to sign up right now, right? And I think it plays out in that go-to-market strategy. That I think this is one of the most challenging things to get right in healthcare, but if you get it right, it's powerful, is that, do I go direct to consumer, or do I go through an employer, or do I go through, the government regulation, or do I go through a hospital system? And I don't know what the right answer is in each case, but there's a lot of different avenues to go. And, my experience has been trying to tackle all of those at once is very difficult. And so I like that each of you had a hypothesis on, yes, we know we could go all of those in the road, but here's where we're starting to get going, to get that focus. I think that's one for those healthcare entrepreneurs out there, that it is important to think through go-to-market strategy in any business, but specifically in healthcare, where there's a lot of very different buyers. And I saw some questions in the chat, who pays and who uses the services. And those are all great things to think about with healthcare businesses.
Yeah, maybe I'll chime in too, just because you were talking about growth, go-to-market kind of. I'd love to hear from each of you from the questions, what's your biggest barrier to growth right now? And if it were removed, what would that result in? Maybe it's software, maybe you've kind of spoke to some of those, but what's just one thing you could share on your biggest barriers to growth right now?
I can start because I just referred to it a minute ago. So for us, our biggest barrier is really the upfront cost. So the equipment costs and getting and raising money on an idea is a little bit more challenging. We're very lucky that we have 5 angels. 2 of them are survivors themselves. That's really, really meaningful to us. But the biggest barrier at the moment is to start. And yeah, that I will leave it at that.
Our biggest barrier is the sales cycle within hospital systems. So if anyone's been in hospital systems, just knows that 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 is a arduous process to getting it in front of the right folks. So that's the biggest barrier to growth.
I think invariably a challenge for everyone is to demonstrate that product market fit, knowing that your version 1.0, maybe half will like, half may not. It'll check off some of the needs, but to have in mind that we will have to continue to iterate, listen to the customer, listen to their stories, build for them and not for you.
I would second what Dr. Thomas said. I completely agree that there's a baby can only be birthed in 9 months, and it takes a certain amount of time to build software, and then it takes a certain amount of time to sell the software, and all the while you have fixed costs with your team that you have to keep paying. And so trying to make all of that work, that's tough, and investors want to see that traction. But again, you have to just stay rooted and committed, and not get too not get too worried, because it will all work out. When you know that you're solving a real problem, and you know that you're doing the work, doing the due diligence to actually bring in those experts. And that's the one thing I just don't think I've done enough to credit the incredible expertise that I think it's worthwhile for every healthcare entrepreneur to take the time to go and sit down and listen carefully to people who've been there, done that, bought the t-shirt, know what they're doing, and listen to their advice. Listen carefully. And like I said, be prepared, have some money, because it's going to, once you start working with developers, I'm just telling you, have some money.
Well, awesome. I know we're coming up on time here, but really appreciate Danae and Jennifer and Stephen and Ali sharing what they're working on. 4 great early Atlanta startups just getting going. Hopefully we'll see many more great things from them here over the coming years. So thanks everybody again for joining today. As JC mentioned, we'll have a recap and record this as well. We'll probably take July off just for the summertime as people are traveling and doing different things. And we'll probably have our next meetup sometime late August. JC put up a couple potential dates here, but always appreciate what everybody's doing here, and feel free to connect with us on the website there, or with anybody through here. But we really appreciate the time and the efforts that all 4 founders are doing. Great conversation, a lot of good learnings, and excited to see all the great things being built here in Atlanta.
Thank you.
Thanks, y'all. Appreciate
All right.
it.
Thanks so much. Everyone have a great day.
Bye-bye.
Bye.
Appreciate you guys. Thanks.
Thank you.